maximum use of earphones, using it regularly, will cause a permanent hearing loss?
This is a message that everybody should listen to. Do not use earphones and headphones. Long after you have stopped using it, your hearing will still drop.
What is a cochlear implant?
This is very important. The device is a miracle of modern medicine. Children who are born deaf, they need to be implanted at the earliest.
Whether to go for an implant or for a hearing aid?
People get confused.
So we do a series of tests.
These tests are absolutely necessary.
How do we know whether the hearing loss is temporary or permanent?
You get the MRI, we look to determine the cause of the hearing loss. In a desperate effort to restore the hearing, we don't stop. We do everything that is in our power to restore hearing.
Are the frequently occurring throat infection an indication for any serious infection?
Yes, indeed. Then this is time to wake up. A simple cold can lead to a serious brain infection.
Hello, this is Neha and welcome to Lilavati Hospital's official podcast series, where we bring you closer to expertise, innovations and patient care that define our institution. In today's episode, we are going to focus on something that we take for granted. That is our ability to hear clearly, breathe effortlessly and speak softly. With the rising cases of sinus issues, hearing concerns, and throat infections, lifestyle-related ENT problems, it becomes increasingly important for us to understand when to ignore these symptoms and when to act. So we have with us at Lilavati Hospital, joining with us Dr. Dsouza, a highly respected ENT surgeon and skull-based surgeon. He is here to guide us through the essential of ear, throat, and nose infections. We welcome you, sir.
Thank you. Thank you very much for your kind introduction. Yes, I'm happy to answer all the questions to our viewers in an effort to help them in everyday language that they will be able to understand.
So, sir, for our guests or our listeners to know, what is a cochlear implant and who are the patients who get benefits from these cochlear implants?
Cochlear implants are miracles of modern medicine. And they are bionic devices. They are electronic in nature. They are inserted directly into the cochlea to stimulate the cochlear nerve. Now, of all the 5 senses, the ENT surgeon is the only one who is privileged and honored with the ability to restore the sense of hearing. At the beginning itself, I must make a distinction between implant and transplant. Transplant means a viable organ from one body being inserted in another. But an implant is a device that is inert and which serves a particular function. So cochlear implants are an electronic device inserted into the cochlea, which is the organ for hearing in the ear, and by electronically and electrically stimulating it, we're able to restore the sense of hearing. Now, as you correctly said, who are the patients who will benefit from these devices? There are 2 categories of patients: those children who are born deaf and those who go deaf after acquiring speech and language. Now, the children who are born deaf, they cannot tell you that they are born deaf. So we have at the Lilavati Hospital, we have all the equipment designed to deal with ascertaining deafness, degree of deafness, and making sure that the child is indeed born deaf, which has profound, irreversible deafness. This is very important because if a mistake is made, you can wrongly diagnose a child being deaf when the child is not. So we do a series of tests over a period of time. Now, the Lilavati Hospital has newborn screening apparatus. As soon as the child is born, the child undergoes a test for hearing. These are known as otoacoustic emissions, or OAE for short. We also check the pressures in their middle ear to see if there's fluid behind the ear. And lastly, we do something called brainstem evoked response audiometry. This is something very similar to an ECG. It works on the same principle. So with this device, we're able to degree the deafness, that if the child is deafness or not, and we can tell from that where the problem lies. So this is one set of patients who are 2 years old. Now the thing is that children who are born deaf, they need to be implanted at the earliest. Now many studies have shown that by the age of 2, if you insert this device in both ears at the same time, the child acquires speech and language just like his normal hearing peers. So fortunately at the Lilavati hospital, we have been inserting cochlear implants in both ears in these children, and we have had the satisfaction to see as time goes by that they are able to develop like a normal child and enroll in schools for children with normal hearing. That's one set. The second set are adults who have gone deaf for one reason and another. Now, the most important thing is to decide the degree of deafness and is it reversible. Now, if the deafness is reversible, we certainly will not insert a cochlear implant. So we first see the degree of deafness and whether it is irreversible. The minute we hear or read the diagnosis as profound, irreversible sensory neural hearing loss, that means this person will likely need a cochlear implant. Now, in India, we have a lot of children who are born deaf, but of those children, maybe 5% are able to access cochlear implants. So that means 95% of children in India do not have their deafness determined and treated. Outside, in other countries like the US and Canada, all children who are born deaf, all will be given a cochlear implant. So the degree of deafness and the treatment of deafness is very well treated abroad in the US. But we have a second category of patients, those adults who were able to speak and hear before who have gone deaf. This usually means deafness in older people. Many studies have shown that deafness, the presence of deafness in one or both ears in senior citizens leads to depression and isolation. Why? Because if the person cannot hear correctly, they will answer incorrectly. This leads me to the statement that we've been talking about. The child who cannot see the blackboard, wears glasses, sees the question clearly and answers clearly. So a lot of people will think that this child is very smart. But the child who is deaf hears incorrectly and will answer incorrectly. The minute that deafness is treated, the child hears correctly and answers correctly. So I want to do away with this false notion. Now, coming back to adults, the minute we insert cochlear implants in them and subject them to rehabilitation, that means to say they learn how to use the device, we find that they get their lives back, the quality of their lives back. They can hear domestic sounds that we take for granted, like the telephone bell, the doorbell. They can also hear and appreciate ordinary conversation, day-to-day conversation. And there are two more important factors. One is that they get directionality. That is to say, they can hear, they can tell where the sound is coming from and look in that direction. And the second thing is that when they go into a public area, they're able to hear what people are saying. So, as I said, the device is a miracle of modern medicine. And as time goes by, the device gets more and more sophisticated, better and better, and people will benefit a lot from it.
For adults, at what time should somebody consider a cochlear implant instead of an hearing aid?
Well, that's a very important thing that I'd like our viewers to know, because people get confused. Now, first of all, what do these patients complain of? What do their relatives say? They want the TV loud, they are not able to hear the doorbell or the telephone bell. And if they are asked a question, they are not able to answer correctly. A lot of people, even though they have deafness, will lip read and somehow provide an answer. The best way, so these are the symptoms that should not be ignored. If the person answers incorrectly, cannot hear the doorbell, so that means this person needs to get their hearing tested. So what are the tests that are involved? The first test which we perform are something known as pure tone audiometry. This means, can you hear a sound, yes or no? So we test each ear individually in a sound-proof room. That means it should not be in the general public where outside noise will interrupt and disturb the test. So we do pure tone audiometry where can you hear a sound, yes or no, at different frequencies and at different levels of intensity. The second test, which is not done very often, unfortunately, but which is absolutely mandatory, is speech audiometry. So we give these persons a word and ask them to repeat it. The word is at different levels of intensity, and we're able to decide the threshold at which they can hear that. So they're given a score. And so we look at what level of intensity they're able to identify the word correctly. That is known as speech reception threshold. Then we do a speech discrimination score. So these words are, they got the two syllables and the emphasis on both the syllables. For example, baseball, ketchup. So if they are able to identify these two words, these two syllables correctly, we give them a score, and that will determine whether this person needs a hearing aid or not. We give a score of 75% if that's the borderline. Anything, if the person hears up to 75% gets a score, that means he's at the borderline, and they may or may not need a hearing depending on how they feel about it. But if it falls below that, then these people will definitely benefit from a hearing aid. The third test that we do is we check the middle ear pressure. Sometimes there's fluid or there's a hole in the eardrum which can cause a hearing problem. So these three tests are absolutely necessary, and we have a wonderfully well-equipped modern audiology department at the Lilavati hospital, which is soundproof and it is manned by experts. So we work in tandem with the audiologists and discuss the tests and their interpretation. Now, if a person fails all three, that means he can't hear any sound, zero discrimination score, and the middle ear pressure test is normal. We do two more tests. We do something called auto-acoustic emission. Again, these are computerized tests and can be replicated at any other hospital. The first three, pure tone, speech, and impedance, these are subjective tests. They're not objective. That means it depends on how well the test is done, does the patient understand clearly. But auto-acoustic emissions and brainstem evoked response audiometry, they can be replicated at any hospital and get the same result. So auto-acoustic emission will tell us what is the condition of the cochlea. The brainstem evoked response audiometry will tell us is the pathway from the cochlea to the brain working correctly or not. So these tests are needed in the determining our patient's hearing levels. Now, when do we ask for auto-acoustic emissions and brainstem evoked response audiometry? That we do this when persons come with a specific problem, like asymmetric hearing loss, that you say one ear is okay, the other is not. If a person complains of giddiness, if a person complains of tinnitus, tinnitus means a constant humming sound in the ear. So if patients present to us with these kind of symptoms, where you have asymmetrical hearing loss and vertigo and tinnitus, then I will get a brainstem evoked response audiometry. I'll look at that, and then from there we can tell where the problem is. This can be followed up with an MRI, magnetic resonant imaging of the brain and the hearing nerve. So if a patient has a hearing loss, say a profound hearing loss in one ear, and the CT scan and the MRI normal, then we advocate a cochlear implant in this patient. Why? Because the person has something called a head shadow effect. That is to say, if the person is deaf on the right side, anybody speaking on the right side will not be heard. Anybody speaking on the left side will be heard. So there's a head shadow effect. The second thing is that the person will not be able to discern from where the sound is arising. When the person goes into a crowded room, he will be totally disoriented. So a cochlear implant done in the non-hearing ear, one, it restores hearing. Two, it gives the person directionality. Three, it keeps the ear ready, because if something bad has happened to one ear, that same problem can happen in the other ear. So we tell people, get the cochlear implant, it will restore your hearing, to get all these benefits like hearing, directionality. Now, that is a very good idea and is being followed by all people all over the world. We have to understand one thing, that it sounds wonderful, and indeed it is. There are certain caveats. That is to say, the hearing from the normal ear will be like normal sound. The hearing from the cochlear implanted ear will be slightly different. But over time, with therapy and correct adjustment of the cochlear implant, the brain fuses the sound into one, and then the person can understand from where the sound is coming, is not disturbed by the slight quality of sound, and it gives the person the benefit of improved quality of life, for which we have done the cochlear implant.
So after the audiometry test, which you mentioned, like there are several tests which are done, how do we know whether the hearing loss is temporary or permanent?
Yes, that is an important thing that faces us. And we treat all persons who come to us with a profound hearing loss, check whether it will be reversible. So what we do is that we get the MRI, we look to determine the cause of the hearing loss. Sometimes it may be because of virus and so on and so forth. So what we have a standard protocol wherein we give the patients antiviral treatment, steroids, both intravenously as well as sometimes we injections at the ear, and a lot of adjunct medicine to see if the hearing can be revived. Now, I've had many patients who've had their hearing revived, but how much it gets revived and whether it returns to normal or not depends on many factors, some of which are beyond our control. But we give them comprehensive treatment in terms of antiviral, steroids, antiplatelet, and so on and so forth, in a desperate effort to restore the hearing. We don't stop. We do everything that is in our power to restore hearing. And then we do audiograms over a period of time. Now, we wait a week, 10 days, and then we monitor the person's hearing. If the person's hearing gets restored, of course, we are very, very happy about it. Sometimes it gets restored partially, but not completely. Sometimes it does not get restored at all. If the person's hearing does not get restored and is now confirmed a profound sensory neural hearing loss, we still wait a period of about 3 to 6 months before we take a decision on whether we should do a cochlear implant or not. Because we do not want to insert a cochlear implant in a patient whose hearing is recovering. If the person's hearing is recovering, we say we are not going to touch this patient. So it involves a lot of experience, a lot of expertise, and all the necessary apparatus which we at the Lilavati hospital are blessed with. We have everything under one roof. So these patients come to us, we're able to treat them effectively and comprehensively.
Is it true that using regularly use of earphones, like most of the people nowadays, they use earphones while traveling in their day-to-day life. So maximum use of earphones, using it regularly, will cause a permanent hearing loss?
Yes, that is what we are seeing. Now, I get a lot of patients who wear earphones and headphones. Now, the way we hear is on the principle of a vibrating reed. The column of air that's open at one end that vibrates. Earphones in particular are bad because they work on the principle of a hearing aid well before you need one. Also, the same goes for headphones. What happens is that we see problems that are known as noise-induced hearing loss, NIHL. Now, people who wear earphones and headphones should remember one thing, that they should not be using it for prolonged periods of time. Now, how long? As yet, there are no firm recommendations, but I would also just suggest to younger people who use these earpods for their phones. These are extremely bad for your hearing in the long run because they work on the principle of a hearing aid. Secondly, you also are subjected to small doses of ionizing radiation. And noise cancellation headphones, the people say, I want to enjoy music. It depends on two things, on duration of usage as well as the volume on which the sound is given. So, like people who are on a long flight in a plane, they say, I want to listen to some music. So I say, well, use it for a short period of time. So they say, how short? Well, I really have no definite figure, but I would say 15 minutes to half an hour, and then stop. Allow your ears to recover and give yourself some time so that your noise, the sound is not transmitted to your ear and leads to fatigue. Initially, when people are subjected to prolonged use of headphones, they say, well, I've got no problem. But you have to understand that it's called cumulative damage. That means small amounts of damage every day can lead to long-term, serious, irreversible problems. And once noise-induced hearing loss sets in, it becomes progressive. That is to say, long after you have stopped using it, your hearing will still drop. So previously we used to call it, industrial noise, where people are working in factories, people are working near aircraft engines. But now we call it noise-induced hearing loss because traffic sounds, the headphones, earphones are not good for your hearing health. So people who say, well, I have to conduct meetings, I tell them stagger it. That is to say, use it for a very limited period of time and then give yourself a chance to recover. If I'm pressed for an answer between earphones and headphones, I say headphones are better than earphones.
So coming to the sinus issues, most of the people nowadays suffer from it. Has modern lifestyle worsened the condition?
Yeah, well, people get sinusitis for all sorts of reasons. You have to remember that the word, and I tell this to my patients, itis means inflammation. Inflammation means irritation. How is that caused? It can be caused to a variety of things. First, smoking. Second, all the pollution that we are subject to. So these things are formidable causes which, cause sinus problems. Why does smoking cause a problem? Now, there has been enough literature and it is well established in medicine that smoking is not only injurious to health, but it causes cancer and other problems. A person who smokes at the age of 20, one cigarette a day, by the time they reach 60, that means over 40 years, the odds of them developing one of three problems is very high. What are the problems? Cancer. Second is that they get a heart attack. And the third, that they are in line for a stroke. But these things are part of modern life. Now, a person who doesn't smoke, sitting next to a person who smokes, will be subject to passive smoke. Also, there's so much of pollution in and around our cities for a variety of reasons that pose a hazard to our health, especially to our respiratory health. Now, when people say sinus problems, in other words, they are actually addressing the respiratory tract. Previously, it was called upper respiratory tract and lower respiratory tract. The vocal cords, anything above it was considered upper respiratory tract. Below the vocal cord was called the lower respiratory tract. But now, there are a lot of as time has gone by, we show that there is actually a unified airway condition. So it's not that it's isolated. What happens in the sinus can affect other parts of the body. The other thing is that fortunately, the powers of healing in the sinus are good. But when it is overwhelmed, then you get a problem. So itis means inflammation, which can be caused by pollution, by infection, by allergy and chemicals and things like that. So it's definitely a major problem. Do not add to, see, we are all affected by all the pollution, but don't give yourself one more problem by smoking. This is a message that everybody should listen to.
So, what are the most commonly ignored symptoms of a serious ENT problem?
Well, bleeding is one thing, where you get bleeding from the nose or bleeding from the mouth. So they come to us and at first they are very alarmed. But then after extensive tests, we are not able to find a particular cause and they continue to bleed. That is very important to them. Cough, difficulty in swallowing, swelling in the neck, a sudden, thing like giddiness and things like that should never be ignored. As soon as you suffer from one of these symptoms, you must see the ENT doctor.
Sir, are the frequently occurring throat infections or changes in voice are an indication for any serious infection?
Yes, indeed. We ask a person, what is your occupation? If they say teacher or preacher, then we say, do you keep on talking all the time? And if they say yes, we examine the vocal cords properly and they have vocal cord nodules. So this is related to their occupation. But a person who has hoarseness, and when we examine the throat and we see that the vocal cord is not moving or there's a growth on it, then this is time to wake up, get the person investigated to rule out any possible malignancy. We should not treat any malignancy like an infectious disease. All malignancies need to be treated by a specialized cancer doctor. Sometimes I find that people will treat cancer like they treat an infectious disease. I'll take this medicine, I'll do that, I'll do this. No, it needs to be seen by a certified, well-trained cancer surgeon.
So your expertise is skull-based surgery. So could you let us know what is skull-based surgeries and what kind of patients need it?
Skull-based surgery is a new discipline. What happens is that there are plates of bone that separate the ear, nose and throat from the brain. So that area is known as the skull base. It is a bone and which following any trauma can get ruptured and can lead to problems. So that is the skull base. What are skull base surgery problems? One is that if following a road traffic accident, they can get brain fluid leaking out from either the nose or the ear. And if brain fluid leaks out, a simple cold can lead to a serious brain infection. The other thing is that some patients, unfortunately, they have tumors from the ear going into the brain, like from the eighth nerve, it leads to an acoustic neuroma, which can go from the ear to the brain, or the pituitary gland, which can, from the brain, come out into the sphenoid sinus. So this requires the collaboration it's a multidisciplinary approach. That is to say that the ENT doctor is well trained, the neurosurgeon, and the use of endoscopes, high-end microscopes, and so on and so forth. And also we involve the eye doctor or the ophthalmologist. So skull-based surgery is a multidisciplinary surgical discipline that has evolved in recent times because of improvements in radiological imaging, that's the X-rays, MRI, CT scans, endoscopes, and well-trained doctors in this field.
Now, as we are near to the end, could you please tell our viewers what are the 5 simple habits that they can adapt to protect their ear, nose and throat?
The 5 simple habits that people should adopt is 1, do not instrument your ear because it is a blind procedure and many people who instrument their ear land up with serious life-threatening infections because the ear is separated from the bone by a thin shelf of bone. The second thing is that do not use earphones and headphones, especially on a prolonged day-to-day basis. 3, do not smoke at all. Smoking, even one a day, people say, I smoke socially, and they act as if it's something trivial. Of course not. You should not smoke even trivially. Lastly, the fourth thing is that no use of pan, tobacco, supari, because that will cause you severe problems. Fifth one is alcohol consumption is good in small doses. Now, when I say that, people interpret it as a license to drink. It's not a license to drink. It is that person after a certain age, I'd say 50 and plus, we say that they can have a little bit of red wine. Now, red wine means 60 ml, not more than that. People will drink a lot more. So up to a certain level is good for your heart. Above that, it will affect your stomach, affect your liver, and create all sorts of other problems for which it is given to treat. So one should not be go overboard about these things. So these are the 5 habits. And if you pay attention to that, I think your ear, nose, and throat should be in good shape.
Yes, sir. Definitely, our viewers are going to be truly beneficial from all the information that you have given us. I hope that our viewers can include or adapt to the habits that you have mentioned just now. That was truly an insightful session, sir, and we were very grateful to have you here today. Thank you so much for being here.
Thank you very much. I just like to conclude by saying that I'm very proud and honored to be associated with the Lilavati Hospital and Research Center, because it has become one of the foremost hospitals, not only in Mumbai but in India. We have all the equipment needed, we have well-trained personnel, and all our facilities that are offered here are simply the best.